Hi, I'm Governor Brad Little. Thank you for inviting me to speak with you today and for allowing me the opportunity to thank you, our counselors, for the critical support and care you provide for Idahoans throughout our state. You have helped fill the unprecedented needs in our behavioral health care system over the past 3 years. From your work in community mental health centers to private practice settings for our military personnel and their families, veterans, and in our schools. You have healed and comforted patients and their families. You have persevered, going above and beyond for patients and celebrating their triumphs. The pandemic highlighted the need to strengthen our investments in behavioral health care services. Lack of access to these types of services and trained behavioral health professionals impacts every Idahoan resident's well-being and quality of life. And the work you all do will continue to play a critical role in the success of our state. We have already taken steps to increase behavioral health care resources in Idaho, including being the first state to establish a 3-branch initiative to improve Idaho's behavioral health delivery system. Never before have the executive, legislative, and judicial branches come together to make a shared vision on behavioral health become a reality. Last year, through the Idaho Behavioral Health Council and my legislative partners, we were able to join the new National Suicide Crisis Lifeline, 988, and secure funding for community behavioral health clinics, recovery centers, psychiatric residential care facilities and programs, safe teen reception centers, and 4 new youth crisis centers in Idaho. This year, I want to continue this momentum by implementing more of the recommendations from our Behavioral Health Council. My Idaho First plan proposes 10% rate increases and expanding behavioral health services to Medicaid beneficiaries, construction of a secure forensic mental health facility to care for patients determined to be dangerously mentally ill by Idaho courts, expanding emergency medical care services in rural Idaho, financial support for additional safe teen reception centers, setting aside funding to bring in more medical residents and address the shortage of care providers across the state, and increase our capacity to serve Idaho's at-risk families with parenting resources and programming. Addressing behavioral health and substance abuse disorders requires us to be both proactive and reactive. That's why my Idaho First plan seeks additional funding for a pre-diversion program so we can help first-time drug users earlier in life. With each passing year, we are seeing more and more Idahoans die from overdose. In recent years, the number of Americans dying from the use of synthetic opioids like fentanyl has skyrocketed. Fentanyl and the flow of other deadly and dangerous drugs into our state presents an extreme risk to our children and the safety of our communities. That's why I started Operation Esto Perpetua last year to help turn the tide and protect our children. We spent months traveling the state to hear from Idahoans affected by fentanyl and drugs. Now, using their input, we're taking steps to protect our youth and communities from this deadly threat. Earlier this year, we launched a new educational awareness campaign, All It Takes, featuring the stories of real Idahoans who lost their lives to accidental fentanyl poisoning. This campaign, which you can learn more about at fentanyltakesall.org, aims to inform our youth about the dangers of fentanyl and other drug use. This effort reinforces a lot of other good work happening in our state to save lives, including better access to life-saving drugs, naloxone and Narcan, expansion of behavioral resources across the state, partnering with people like you, our counselors and healthcare leaders, to strategically address all the factors that contribute to the epidemic before us. I want to thank everyone here and across Idaho who's contributing their time and talent to supporting our residents and making our state a safe, healthy place to live. Together, We are expanding Idaho's behavioral health system and helping Idahoans access the right care in the right place at the right time. Thank you.